Respiratory syncytial virus, RSV, is a common, highly contagious virus that affects the lungs and respiratory tract, mainly of infants under the age of 2. It spreads through respiratory droplets, for example when an infected person coughs or sneezes. It can survive on surfaces for several hours, making transmission of the virus very easy. In most people, RSV causes mild, cold-like symptoms such as a runny nose, coughing, sneezing, fever, wheezing, and a decrease in appetite. Symptoms appear within 4 to 6 days after infection, and most people recover from the symptoms on their own using self-care measures. However, RSV can cause more serious symptoms, such as breathing difficulties and irritability in certain groups including infants under the age of 6 months, premature infants, people with lung conditions such as cystic fibrosis or chronic lung diseases, and individuals with compromised immune systems. In high-risk groups, RSV can lead to serious complications, such as bronchiolitis, inflammation of the small airways in the lungs, and pneumonia, inflammation of the alveoli of the lungs. It is the leading cause of hospitalization of infants under the age of 2 in the UK. Vaccine programs to prevent severe RSV disease are available for pregnant women, newborns, and people in high-risk groups. It is recommended that pregnant women be given a maternal RSV vaccine between weeks 32 and 36, that is, the 3rd trimester. The protective antibodies last from birth to the first 6 months after birth. Premature newborns who were born before 32 weeks, babies under the age of 8 months whose mothers did not receive RSV vaccination, and infants who are at increased risk of RSV and are aged between 8 and 19 months, can now be given an infant RSV antibody called nirsevimab. Nirsevimab provides direct immunity against RSV infection and lasts approximately 5 months after vaccination.